Good afternoon, everyone. Ladies and gentlemen, I'm delighted to be joined here on stage by Anurag Hans, Head of Mission at EssilorLuxottica and President of OneSight EssilorLuxottica Foundation. And a very special guest joining us virtually, if our producers could pull her up on screen, is Dr. Oteri Okolo, Director and National Coordinator of the National Eye Health Program from the Federal Ministry of Health and Social Welfare in Nigeria. Welcome, Dr. Okolo. Welcome, Anurag.
Thank you, Richard.
Anurag, maybe I could start with you. We've talked about this earlier. A staggering 2.7 billion people globally, primarily in low and middle income countries, lack vision correction. Could you walk us through the impact of uncorrected vision, not only on individuals but on societies as a whole, and perhaps briefly how increased access to vision care really helps us to, as a community, achieve the UN Sustainable Development Goals?
Well, the state of the problem is that 1 in 3 people can't see clearly. Now, that might not be true in this room or in the context that we usually go around in, but that's true in most developing and underdeveloped regions. So, if you think about what the ability to see clearly does, you will realize that this is not a health issue. This is a quality of life issue, and therefore, there've been numerous studies on the impact of this problem. Runs into hundreds of billions lost in productivity in global GDP. And if you look at the impact across multiple SDGs, it's just intuitive that not being able to see clearly has an impact on the ability to earn a livelihood, gender equality, education outcomes, and even something as far-fetched as climate action. Because when you do not have good vision care and you do not have good access to opportunities in rural areas, you tend to migrate to urban centers. So it's truly a cross-cutting quality of life issue that can be solved through solutions which exist today.
Thanks for setting the scene, Anurag. And Dr. Okolo, turning to you, you've long worked to improve access to eye services for underserved communities in your country, Nigeria. Can you briefly talk us through the most significant barriers that are hindering access to quality eye care services in the communities in which you're working?
Thank you very much for the question. I think the first thing to note is that in the communities, you have 70% of Nigerians residing in the community level. That's more or less the rural areas. And then while the health system is structured to address their health needs, it also becomes a barrier because, the primary healthcare system is what is available at the community level. And often more than not, the primary healthcare system is not as resourced as other tiers of the healthcare system, like the secondary and tertiary health system. So despite the fact that you have primary healthcare centers located in the communities, the presence of eye care services is absent because long before now, eye care has not been integrated in the primary healthcare system. And then also you can even find that you don't have healthcare workers also present in the primary healthcare system. We've talked about brain drain in other sectors, in other discussions. That has also affected and also constituted itself as a barrier to healthcare. And then even the primary healthcare workers in these areas, in these communities, from my experience, from the work we have been doing, do not even have access to a simple pair of reading glasses. And if you imagine that often primary healthcare workers have to dispense vaccines and drugs from vials that have very tiny font sizes, using vaccines with very small font size calibration, you can imagine what implication that has for patient safety. Other barriers as health system barriers are the high cost of healthcare in our communities, lack of health insurance, because most of the people in these communities work in the informal sector and that they do not have access to insurance. Then you also have poor infrastructure and poor equipment. Now, as regards patient-related factors, you have poor knowledge of the healthcare service, poor knowledge of where to access care. You have myths and misconceptions about eye care conditions that are rooted in the culture.
I think we've lost the line to Nigeria. You were
Then
briefly...
you have cost issues.
Dr. Okolo, please go ahead. I think there's a slight delay on the line, but if you could wrap up that point, then we can move on to the topic of telerefraction, which I know we wanted to spend a few minutes on today.
Okay, so other barriers are cost, direct cost and indirect cost, and then of course gender inequality as regards females, women and girls having access to eye care services. So I think generally that's my answer for that question. Then we can go along. Thank you.
Dr. Okolo, thank you. Anurag, remote eye exams or telerefraction, could you unpack for us a little bit about the opportunity for healthcare professionals, and particularly how they're suited to bridging current gaps in countries like Nigeria that Dr. Okolo is joining us from now?
So if you look at the cause of the problem, so I said that this is a quality of life issue, and if you look at the solution, the main barriers are access. There is no place for these communities to go and get a simple pair of eyeglasses after an eye exam, and the second is a lack of awareness. Now there are two approaches. The first one is, how do we go about building what can be seen as a parallel workforce, and I see that this is a challenge across health contexts. Not only for vision care, but now technology has enabled us to make sure that we are able to partner with the existing workforce, and without asking them to move from their current location in urban areas, to participate in the process of solving this issue in rural areas by overseeing refractions which are happening over a mobile platform. And in this way, the rate of scale up of creating a virtual workforce which is available wherever the problem exists is going to be 10x faster than the process of actually training hundreds of thousands of these technicians, who sometimes even are not available in the right supply in urban areas. So we've done some tests, we've done some pilots both in India and in Kenya, and the accuracy levels of a refraction conducted through a telerefraction come out very close to an in-person refraction. So that gives us the confidence that this could be one of the ways we can unlock the workforce challenge that Dr. Okolo was also talking about.
And then Dr. Okolo, from your perspective, what's the biggest potential benefit that you see for telerefraction in addressing some of the vision care challenges that you outlined earlier? What's one thing that really is moving the needle here?
So apart from access, which Anurag has explained, we will also ensure this telerefraction will also improve the quality and quantity of eye care services that are available to people in remote locations, and usually these people are usually underserved. And like he also mentioned, technology will also significantly reduce the cost in terms of transportation to these places, in terms of infrastructure, and in terms of even cost for personnel. And this is very critical for resource countries that are resource poor, like Nigeria, and communities where most of the population reside. And then also beyond this would also improve patient engagement. So you create like an interface between service providers and the patient, so they are closer to the health system than already exists. And then also this will also empower this patient to take a more active role in their healthcare, and this will ensure improved uptake in eye care services, and then improve the number of people, or the numbers of people that have good vision and therefore are able to contribute productively to the economy of the nation. Beyond just telerefraction. We also have telemedicine, which can open up the space, increase specialist care to rural areas. You can have use of mobile health apps, for instance, which can also be used to educate patients. Like I heard another speaker talking about the fact that prevention needs to be brought to the front burner. So a lot of these people do not know about eye care, do not know about the simple things that they can do to improve eye care. So this can also expand the space.
Thank you, Dr. Okolo. And Anurag, I know time is short, but I wanted to have a few words from you on the recently launched WHO SPECS 2030 strategy, and specifically your sense of how telerefraction plays into that strategy and the potential it holds.
Well, it's directly connected to what I was saying earlier, and then Dr. Okolo was also saying. WHO announcing a strategy around refractive error itself, I think, is going to be a big shot in the arm for all the efforts around vision care. Now, if you look at that strategy, one of the main bottlenecks or barriers identified are the lack of workforce, in remote areas, and this gives us the opportunity to take care of that main barrier at 10x the rate, and probably at 1/10 of the cost. So
in that sense, it's a best buy. Dr. Okolo, final thoughts from you. Do you have a key message for our audience here in Geneva this week at WHA, for all of the audience watching along online around the world, in terms of the potential of telerefraction and vision care? Final word from you, please.
My final word is just to say that the eye care community globally has done a lot as regards reducing the prevalence of blindness globally, right from the 90s up until now. We have partnered to reduce the prevalence of infectious causes for blindness like trachoma and onchocerciasis. And I believe we can come together to embrace technology and telerefraction as a key factor towards ensuring Vision 2020 for every individual, irrespective of their ability to pay, irrespective of where they live, irrespective of their gender, to be able to have access to 2020 vision for all. So I call on governments, I call on partners, the private sector, health providers, policymakers, tech innovators, patients and communities to take advantage of this moment, come together and create a momentum behind this to be able to ensure that we have this access services available to people in communities. Thank you very much.
There's certainly a lot of groups on the hook there. Anurag, a final call to action from you.
Just one other aspect of why having a telerefraction or a digital model is important is also because there's a lot of exciting stuff happening in the AI space. We see that there are new capabilities being developed by going and creating a platform of telerefraction. We are also getting ourselves ready for a potential AI-based solution which might become available tomorrow and can be readily deployed, because both the remote technician and the optometrist who's sitting in the urban area are digitally enabled. Call to action would be to governments who want to take action around quality of life through the route of vision care, to other organizations who want to create impact across seemingly unrelated impact areas, but through the course of vision care. We would love to have a conversation. We would love to have a dialogue on how we can use the work which is happening in vision care to deliver multiple outcomes.
I think we'll have to leave it there, Anurag. But Anurag Hans, Dr. Oteri, Okolo, thank you very much for joining us today. And I will hand over. Stay tuned for a conversation with the Devex CheckUp team. Thank you very much.
Thank you, Oteri.